things. We've got the slides. Shannon, you can post the slides in the chat room for us if you didn't do that already. In the chat box. So Shannon will put the slides in the chat box, and then they're also on the CT Boss website as always, or will be at least by the end of the day today. We're also recording this today, so be available on the CT Boss website as well. The participants are muted, so if you want to, participants are going to stay muted, so if you want to ask a question or make a comment, please do that in the chat box. For the folks that are presenting, you should be able to mute and unmute yourself, so please feel free to do that. And just, you can chat with Shannon or I if you have trouble doing that. I think that's all of the housekeeping stuff. Did I miss anything, Shannon?
No. Did we talk about the presenters, or we're going to do that later?
I said
the time for the presenters.
Yeah, I did that. Okay, so so I'm going to turn it over to Brenda, and she's going to just do a quick welcome and introduction for us.
Great, thank you. So I just wanted to say hi and just thank everyone again for your time. I think these have been really helpful to have every couple of weeks information. I want to thank ahead of time. We have a couple presenters today. As you know, I've been kind of reaching out to all the different PATH programs over the last month or so, 5-6 weeks. And there's a lot of really great things happening out there. As I keep saying, you guys are the front line. You're out there. You're seeing what's going on with everybody. So we thought it'd be a really good idea to bring some of you on today to share some of what you're doing, what you're seeing, and then maybe some other programs can get some good ideas from that, and then maybe they can share theirs as well on another call. I don't have any big PATH updates. Submit the PATH application to SAMHSA early, so thank you so much for your responsiveness, for your IUPs and your budgets. So I'll keep you posted once that gets in, and that's really all I have. So with that, let's get started.
All right, thanks, Brenda. So this is our agenda. We're gonna have an update from CCEH and from DOH. I'm gonna talk real quickly about some and resources that we've located from some of the other groups that are doing outreach work nationally. And then we're gonna have, as Brenda said, some presenters from CHR and Columbus House talk about what they're doing locally to make sure that unsheltered folks who are being placed in hotels and motels are getting really good quality service.
Michelle is convening a committee of CAN leads on Friday to develop the plan for widespread testing of people experiencing homelessness. Kelly Fitzgerald of Greater New Haven CAN is taking point for reporting back from that committee to CAN leadership and other stakeholders. Unsheltered homeless is a priority. Time frame is unclear as of today. Leaders as well as CCEH newsletter will share announcements as the plan develops. That's the CCEH update.
Great, thanks so much, Brenda. Great. Okay, and we'll have CCEH on future webinars to give updates also. So I'm going to turn it over to Lee, and Lee's going to talk a little bit about what's going on at the hotels and motels. Lee, I think you're muted. I'm going to unmute you.
There we go. I was having trouble getting it off. Hey, everybody. So just to add to CCH's update about the hotels, is that in some municipalities they are starting testing as soon as next week. I know in Waterbury, Staywell was starting to test, I think even prior to Monday, doing some of the testing there as well. So I think in some places our healthcare providers have been very supportive of the need for testing and making sure that it's getting off the ground. So in addition, I think in terms of what's happening at the hotels and motels, the state has extended access to funding through June 30th at those locations. You know, we had been operating on a May 31st deadline, but that has been extended as of now. And certainly, and I hope many of you are participating or starting to have these conversations in your local cans, but really right now the focus is on getting people housed and connecting them to housing. The state has the CARES Act funding that DOH has been awarded through its Emergency Solutions Grant, or ESG for short. And so we have started to have some conversations with the to talk about how to get that money out onto the streets for people, so that any of the clients that you all are working with could have access to some rapid rehousing funds as it becomes available. So DOH does not have that funding in hand right now, but we are starting our planning efforts so that as soon as that money reaches the DOH bank account from HUD, we will be able to really ramp up and make sure that people have access to those funds. But I will also pause for a minute just in case there's any questions from the group.
Does anyone have questions? Remember, you can put questions in the chat box. All right, I don't see any questions, but at any time, if you've got questions, please throw them up there in the chat box. Shannon will keep her eye on that, and we will get you answers today if we can, or if not, get back to you with answers. So, all right. I am going to talk quickly now about some new information that we have been able to gather from our different partners or different organizations that are doing outreach work nationally. So the first thing we wanted to make sure that you guys knew is that the CDC has updated their guidance on working with people who are in unsheltered homeless locations. So that guidance came out earlier this month. And there's not a ton of substantive changes. The change is really around if you guys are doing any symptom screening that includes checking people's temperatures. There's some new guidance there about, if possible, using a physical barrier to do that. So probably the best way to do that, I couldn't find a good picture of this on the internet, but it would be kind of the reverse of what you see here, right? So you would be inside your car and you would have the window mostly rolled up, and you would take someone's temperature through that slightly open window. It's hard for me to envision another practical method in a street outreach setting for some sort of physical barrier. But I think basically the message is that PPE alone is going to be less effective, certainly more effective than not having PPE, but less effective than some sort of physical barrier. If you have to come into close contact, so the CDC says within that 6 feet with someone, and you don't have a barrier, then you want to make sure that you've got a face mask. And I think this is new on the CDC guidance, although it's very difficult to say the way that they're doing it, what specifically has been updated, but I think this is new. They are also now recommending eye protection. So that can be either the kind of face shield that you see pictured here, or when those are not available, a lot of folks are using ski goggles or other sorts of goggles, and then of course, disposable gloves. All right. We also found what we think is a very helpful resource. You guys can check it out and see whether or not you agree that it's helpful. It's linked at the bottom of this slide. It's called the Pandemic Handbook for Outreach Workers, and it was generated by a healthcare network in Nashville, Tennessee. And it's got some really good guidance about how to make sure that you guys as outreach workers are not introducing COVID risks the guidebook is specifically for encampments, but I think that a lot of the guidance is broadly applicable outside of just encampments. So basically how to reduce the risks that you're introducing COVID-19 to the people that you work with. And one of the things that they suggest is that you have for yourselves a daily self-monitoring routine where you're taking your temperature every day, you're screening yourself for symptoms, you're screening everyone in your household for symptoms, and that you not be doing outreach, of course, if you don't have PPE, and then if you or anyone in your household has symptoms or is sick, or if you've had an exposure risk in the past 14 days, and how they define an exposure risk is included here on this slide. I won't go through it. The other advice that they have about limiting your risk of you introducing COVID is that, of course, I think you guys are probably mostly already doing this. You want to limit the number of people who visit the encampment. And to the extent that, sometimes for safety reasons, you've got more than one person going, more than one worker going, that those folks not travel in the same vehicle, that the two workers should also be maintaining social distance and should not be traveling in the same vehicle. Some of this guidance, there's definitely the guidance in this handbook is a lot more detailed than the guidance that's available from the CDC. And in some cases, it's a little bit more stringent than the guidance from the CDC. So for example, they recommend that you maintain at least 10 feet from everyone, and the CDC has been saying 6 feet. So again, some of this is about your own personal comfort level. Of course, if your agency has particular guidance that they want you to follow, you should follow that guidance. They also make clear, they've got a protocol for what folks should do each encampment, and that includes a link to the CDC guidance on the correct sequence for putting on and taking off PPE. So if you're not familiar with that, you want to check it out. They suggest that outreach workers carry their phones in a new sealable plastic bag, and that you keep your phone in that plastic bag the entire time that you're doing outreach, and that because the face masks, we know they're uncomfortable, of course they're a pain, but they also make it hard for you want to make sure that when you're approaching people, they know who you are. And so what they recommend, I think it can be tempting to do like the pull the face mask down to your chin and then put it up and pull it down, and that really all the guidance suggests that that's a bad practice, right? So what they suggest in this handbook is that you approach close enough, but further than 10 feet, that people can see you and recognize who you are. Then you put on your face mask and you leave your face mask in place until you're more than 10 feet away again, and then you remove your face mask. And there's guidance on the CDC website also specific to removing and putting on a website. There's a lot of other stuff in this handbook. I'm not going to go through all this, but one of the protocols for what you do before you enter your home after you've done outreach, as well as some laundry procedures for how to launder your stuff. So take a look at it if you think it might be helpful. The other thing we wanted to talk about real quickly from our national partners is apropos to today's topic about how best to serve people in hotels and motels. LA Family Housing has created a very specific services protocol that they are using in LA County. So it really is, the goal, obviously, we know that this opportunity to place unsheltered folks in hotels is a tremendous opportunity to be able to get people in one place, know where they are, hook them up with services, and get them housed so that when they have to leave the hotel, they are not returning to unsheltered homelessness, but rather to housing. And so this plan that LA Family Housing has created is totally with that goal in mind. It's a 12-week plan. So I think it probably needs to be expedited because Lee just said that the hotels in Connecticut, we're only sure that they're going to be open for 30 days. But it really plan, right? So the idea is not to start from scratch with people, but rather to leverage the information and the resources, the information that's already known about the person and the resources that the person's already connected to, and get everyone coordinated towards the goal of safely housing someone. So I'm gonna go through, this is the plan itself. It's very hard to read on the slide. So we've reached out to them to try and get this in a different format that's easier to read. But in the meantime, what we've done is we've pulled out some of the most important pieces into the next set of slides. So the plan breaks down the tasks in different time increments. So the first tasks are days 1 to 3, and that's when somebody's initially enrolled in the hotel. That's where when the assessment begins immediately. And also the hotel team is immediately reviewing information that's available in HMIS about this client. So you're not starting from scratch with people. Then in weeks 1 to 3, they start to do an assessment. So at this point, it's their intake team that's doing the assessment. And basically they're contacting whoever referred the person and all the collaterals that have been identified either through the person, through the referral, or through HMIS to try to identify who's working with this person, what plans are already in place, and what resources can be leveraged. And that's also where they identify who's the best person to serve as the care coordinator for this person, right? So for example, it might be the outreach worker that serves as the care coordinator. If the person's already linked to PSH, it might be the PSH staff, but that's when they decide who that person is going to be. That care coordinator then becomes not necessarily the case manager. If the person already has a primary case manager, they just become the coordinator of whomever is involved. And the care coordinator is the person that is responsible for making sure that there's an exit plan with the person. And then after, and again, this is good, this would probably need to be expedited because now we're already at week 3, which is going to be too long. Plan updated and to continue to make sure that all of any service providers are all aligned in their efforts to help the person implement that exit plan and be able to get housed at the end of the hotel stay. And then finally, they're doing some discharge planning. So 2 weeks before the exit date, they are starting to plan for the discharge. Certainly working with the on-site hotel staff to plan for the checkout, working with wherever the person's going to go next to try and plan to make sure that it's a smooth transition and that the person is really set up to stabilize in the new housing location. And then throughout at all of these steps, because in the middle of the crisis, even on a normal day, it can be very hard, I think, for you guys to prioritize HMIS. And so in this model, it's the care coordinator who has the primary responsibility for making sure that everything is updated in HMIS and all the documents are current in HMIS. So, all right, that's it. I'm going to turn it over to Malika now from CHR, and we'll take any questions that people have if we have time at the end, or again, please use the chat box. So Malika, take it away.
Can you hear me?
Yep.
Okay. Hi, everyone. Malika Nelson from CHR. I oversee the PATH team. I'm here. And I just wanted to give just a very brief rundown of some of the things that my staff are doing currently that while they are outreaching some of their clients in the hotels and motels. Some of the best practices that they are providing right now is they definitely do call their clients the day before and the day of to ask them, how do they feel? Do you have any coughing, sore throat, body aches, just to gauge to see how they're doing before heading out to go see them. If they're okay, they definitely do meet outside of the hotel. They do not go into the room. If there is a balcony, they would stay on the balcony and just be as far apart as possible. Always wear masks. If the client does not have a mask, we would offer them a mask as well. and just try to be as private as possible, even though it's hard to do, but just find a space where they could keep the distance at the same time, conduct business as usual. If there's any documents that needs to be signed, one of the things we do is we have to offer them hand sanitizer and have them put on gloves, so they could sign anything that needs to be signed, and watch them, make sure that, take it out safely and sanitize their hands. One of the things that we also did is during COVID, we never changed our outreach plan. We stayed consistent with the days and hours that we went out, so nothing was cut back. We wanted to make sure that they know that we were there for them and that we were going to provide the same kind of services that we always did, especially in a time like this, but do it in a safe way. Throughout all this pandemic, we have had some success stories. We have had, in itself, I think having the clients in the hotels and motels, I think is a success story, because they get to attend to their hygiene and take safety precautions. Otherwise, they wouldn't have the opportunity to do if they're outside. If they end up being sick, they could self-isolate and having the ability to recover in a safe and comfortable environment. I think that's a success story as well. We had an individual who had no form of income come into us, and within 2 weeks, one of my staff was able to get him SSI, which now puts him to the ability to get housing on his own. So that was very quick, and he was able to maneuver out very quickly. We've also had individuals during the pandemic who was also housed through either PSH or rapid rehousing, with my team quickly trying to get them document ready and to move them along. So we had a couple of people who were housed during this time. What else? With every successes, there are always challenges. I think at the beginning of the pandemic, we did not have any supplies to give the clients, like mask sanitizers or gloves or anything like that. As we know, there was a shortage, so we didn't have anything to give in the very beginning. But as time went on, we were able to at least provide some of these items to them. One of the challenges we faced is our clients who we did have some clients who they didn't have any access to any facilities that they normally would to attend to their hygiene. So that was a barrier during all of this. Some individuals needed IDs and birth certificates and so forth, and some of the agencies were operating in limited capacity or probably not at all. So that also provided a barrier for us to try to hurry up and get them ready to be document ready. One of the challenges, I also had a new staff who started outreach virtually. That was hard. That was something that was very challenging, but both my staff worked very well together, trailing each other, each in his own car, trying to show the outreach routes and, doing what we can with the situation that we had. So that was a little challenge, but it ended up being great because he was a very fast learner, and not being able to transport clients, because obviously clients being in the same, because as us were also a challenge, because normally we would be able to bring them to where they needed to go. Some of the resources we were able to provide them is one of the other programs that I oversee has a food pantry. So we were able to bring them food very frequently, stuff that they could use in the hotels. So that was in abundance. Usually we have a time frame of when you could get food, but we actually squashed that for them because we know they needed to get food and get items, and we're able to get little care items together for them that they could use in the hotels as well. We also were able to provide masks as it became available, and we also gave them resources to, if they had the capacity to use virtual connection, we gave them a list of phone numbers if they get lonely or sad or whatever it was, phone numbers they could call virtually or just talking on the phone. So we made sure they had that information as well. If during the night they need someone to talk to, and also information of where to go if they believe that they had symptoms of COVID. So those are just some of the things that we did during this time. And hopefully as things go, we'll try to improve and add more items and be able to help a little bit more and get people housed a little faster. That's it.
Thank you so much, Malaika. I'm so glad that you shared some success during this time. It's always important, but especially during this time, to keep focused on the positives and the bright spots. So thank you. Does anyone have any questions for Malaika? Shannon, we don't have any questions in the chat box. I just lost the chat box for some reason.
No questions in the chat box right now.
Okay. So I just wanted to share one quick resource that's related to something that Malaika raised. She talked a little bit about, folks that are not necessarily following the masking or the, whatever the protocols are. And so there is a resource that we added recently to the CT Boss website on trauma-informed, harm reduction informed ways of addressing people not following the safety protocols. So it's mostly geared towards congregate settings, but I think there's also some information in there that's useful in the outreach settings. So if you're not able to, if you think that would be helpful, check it out. It's in the FAQ document on the CT Boss website. All right, so Will or Caroline, I don't know who wants to go first from Columbus House.
There we go. Can you hear me?
Yeah.
Yeah.
Okay, so I'll introduce myself and Will. So I'm Caroline Perez. I'm the manager of Middlesex Services for Columbus House. And my role is that I oversee the PATH program. And Will Carpenter is the manager of emergency services. And he is the manager who's actually overseeing some of the activities that are going on at the Red Roof Inn for Columbus House's role. So we figured that both of us would present because we are working collaboratively together, and we actually have this really great benefit that internally we are helping to run the hotel and also do PATH. So Will, I don't know if you want to kind of talk about the entry side of things, and then we can transition over to where PATH fits in with this.
Sure, thank you. Nice to see everybody. So we have a very similar experience to Malika, except for our intakes are happening inside. The hotel asks that we have our own separate room. So we have a king size room that we conduct our intakes in. Our staff or myself stay on one side of the room, and the clients coming in will stay on the other side. Similarly, we have masks available, hand sanitizer. There's a bathroom right there, so we ask them to wash their hands. They have their own pens. The intake process is generally pretty smooth, pretty quick. We call them the night before. When we first started, our CAN, the MMW CAN coordinators were taking care of setting up intakes for us, but they asked that the shelters take that over starting this week. So starting Monday, we've been calling the clients in setting up intakes for them, which has been going pretty smoothly. Supplies were also an issue in the beginning. I think recently we've had a ton of donations, so we're able to provide all of our clients with masks. We've had cloth donations. We have surgical masks. Hand sanitizer has been going out. We also have the issues with clients refusing to use masks initially. We've seen less of that recently as we've kept providing messaging about the benefits to themselves and to everyone around them, and just stressing the importance of wearing their masks at all times. We have issues with clients congregating outside, smoking cigarettes and sharing cigarettes, which is always upsetting to see. But there's really not much we can do to stop that, I don't think. We've also had some successes as well. We've, I think, housed on the Columbus House side. So we're sharing the hotel, the Red Roof Inn in Meriden, with Shelter Now in Meriden as well. So I can't speak to how many clients they've housed, but Columbus House, we've housed 4 clients since we've been at the hotel. And we're hoping, there's obviously the rapid exit money coming in. We have some additional rapid housing monies as well. So we're hoping to increase that number as the clients become a little more settled. We've also had some success referring clients to Elara, which is a VNH program. So we have some visiting nurses coming in to our clients who need that as well. Yeah, I think that's generally it. I don't know if Caroline wanted to go into more detail about the PATH outreach program that we have as well.
Sure. So what's been helpful is that we have the clients all in one place. So that's been very beneficial. I should say most of the clients all in one place, because as we know, we do still have unsheltered. One of the challenges that we found when we first started was thinking everyone's all in one place, we would have easy access to them. However, some of them still don't have phones, and the hotel will not transfer the call over because, again, we can't call the hotel to then get transferred to clients. For whatever reason, clients are not utilizing the hotel phone to then get in touch with our staff. So what we've done is that my staff were first starting to go earlier in the morning, then they started trying to go in mid-afternoon because they do help deliver some of the lunches twice a week. And now what they started to do is they go 1 day a week during lunch hour, and then 1 day a week they're going in the evening hours when curfew is, so that way we know people are there. It's still challenging because they don't always answer their door. So even though they're there and we know that they're there, they're knocking on the doors and people aren't answering. So we are still experiencing that challenge, much similar to if they were staying outside. So that has been a little difficult. My staff, in a matter of about 2 weeks, did 21 first contacts, which was really great. Again, we're getting better with tracking. And so unfortunately, sometimes my staff were talking to clients who were already connected, or they would have talked to somebody and then the next day they were matched to rapid rehousing. So it's been very quick, but there's a lot of work that they're doing. And then I don't want to say it's for nothing, but then they're not taking on anybody on their caseload because they're already connected to somebody else. But they have managed to enroll a couple of clients from the hotel because they would have been warming center clients or unsheltered. The benefit too is one of my PATH case managers is trained in doing CAN assessments, so he is doing CAN assessments in the field. And again, some people are still refusing to go to shelter or even the hotel, that they do want to remain out in the shoreline area or in their own vehicle. They are still maintaining the outside outreach as well. We didn't deviate too much from our outreach plan either. The only places that we're not able to really reach out to very well is the shoreline. We had started to integrate ourselves out there, but once the agency started to shut down, who were giving us tips of where people were, we didn't really have anywhere else to look. And the shoreline is such a big area, we wouldn't even know where to start. So we do still have contacts who, if they do find out that somebody's out there, we go. We are working with somebody actually in Old Saybrook at this time. And they are still doing their regular outreach. They do it every other week. They alternate between early morning and evening. So they'll go at 5:30 in the morning 1 week, and then the following week they'll go between 7 p.m. and 11 p.m. And they are still encountering some folks outside who are not interested in shelter. I think that's most of what's happening for us. And also I can relate to Malika that I did also have a new staff start during this. So I think he came to the office for maybe a week and then COVID happened. So trying to do the training was extremely challenging. And then I have 1.5 staff. My full-time case manager had potential exposure to COVID. So we had to have him quarantine for a bit before we could then integrate him. So there was a lot of challenges at the beginning, but I think we're in a really good system right now. And again, the communication with Will and his team has been great, because if my staff need to speak to someone, we let Will know, please make sure this person is there and is aware that my team will be going to speak with them. So.
Lauren, we can't hear you.
There we go. I was just saying thank you to our presenters and just saying how impressed we can at Housing Innovations continue to be by the fact that despite all of these challenges, like I can't even imagine having a new outreach worker start during this time. And yet you guys have really just stepped up and figured it out and are making it work, right? Because you're housing people. So I just want to say, Will put a comment in the comment box. He wanted to let people know that he forgot to add that Hartford Healthcare is going to be providing COVID-19 testing for the clients at the Red Roof Inn in Meriden next Wednesday. So that's great. We know that the prevalence of COVID has been very, very high among certain cohorts of homeless people that have been tested. So the more testing we can do, both in congregate settings and of anybody that's still outside, the better. Does anyone have, I have a couple questions if no one else has questions, but I want to make sure you guys get your questions answered first. Does anyone have questions they want to ask any of our presenters? Okay. So the first question I have is about something that Malika said that, which totally makes sense because it's such a transmission risk that you guys are not able to transport clients. So how are folks getting to the hotels if they don't have transportation? That seems like a challenge. Can we unmute Malika?
I thought she could, if you can unmute yourself, go ahead.
Sorry, I was trying. And I know for a fact that the buses was free. They were offering free rides, and one of the individuals actually drives. So one of my staff drove in front while he followed because he tried once and he got lost. So we helped him in that way. So those were the ways that they were able to get to, thank God. And it was on a bus route, so it worked out.
So that's great. So because it's safe, but also supportive, and make sure that at the end of the day, the person gets there. That's a great creative solution. Thanks, Malika. The other question that I had was in response to something that the folks at Columbus House were saying about how there might be various workers, right, involved with somebody. So how are you guys deciding who the primary worker is going to be that's responsible for helping somebody to identify housing and exit the hotel into housing?
Mm-hmm. So our director, Andrew Black, has created an extensive spreadsheet for us now where he's tracking every single person that's in the hotel. There's also on the spreadsheet if somebody's being quarantined for any reason. We also know that that's in HMIS now where we can add symptoms if necessary, but he's also put where was the person referred from, who's the person connected to. If somebody is not connected to any services, then PATH is going to be the primary to then work with that person, and then PATH will determine if they should be referred to one of our other programs or if they will be taken under the PATH caseload.
That's great. So that sounds like that's happening at the agency level, not at the CAN level at this point. So you guys are sort of taking the lead for that hotel for the people.
So he does share it with Shelter Now as well as our CAN coordinator. It's a spreadsheet that he sends on a weekly basis. So everybody is connected and very well aware of who is working with who and who's responsible. So
awesome.
And initially we were alternating days. Shelter Now would take whatever intake clients were coming in on a Monday, then we would do Tuesday. At this point, we're just going down the list and then we're each setting up our individual intakes. It was, additionally, it was a bit difficult for us because both the programs that I run are typically seasonal, and they would have closed the same day we decompressed our shelters and moved over to the hotel. So we do have some clients left over from the Wallingford Emergency Shelter who moved to the hotel in Meriden. So they were already attached to a case manager who just has since transitioned over to there as well.
Great. Does anyone else have questions? So I see there's a question in the chat box, it looks like from Rob, which is, what is the frequency of health screenings with guests at the hotel?
So I'll speak for the Columbus House. On our initial intake, we have the COVID-19 screening that Lee helped us put together in the beginning. We're also taking temperature upon arrival. And now we're taking temperature weekly as well. And just basically every time we're delivering, it's at dinner service, we're just going through the questions. Have you been in contact with anyone with COVID? Have you any new symptoms, cough, fever? anything like that.
And do you know, is there a plan for, I know you said there's going to be testing on Wednesday. Is there a plan yet for repeat testing? So
we're hoping at least 2 rounds of testing. So the initial baseline test will be Wednesday, and we're hoping to get a second round of testing sometime in June.
Great. Great.
And
I know
Hartford
that's
Healthcare seems to be on board with that as well.
great. That's a place I think where there's been a little frustration nationally because there hasn't been a lot of clear guidance around how often homeless folks should be tested, whether it's in sheltered settings or unsheltered settings. And so I think each community is sort of figuring it out for themselves. And I've seen anywhere from, once every 3 days to, once every 2 weeks or even once a month. And a lot of times it's just driven by the availability of the testing capacity. Are there other questions that folks have today for our presenters? All right. Feel free to pop in with a question at any time. I am going to go ahead and turn it over to Shannon.
All right. I'm not seeing the slides. And I'm not hearing you.
You weren't hearing me because
Sorry.
I was muted. But the slides should be up. Are other people not seeing the slides also? My computer's showing that they're shared. No one's seeing the slides?
No, then,
Okay, I'm going to stop the share and restart. Sorry.
Okay.
Why don't you just go ahead through, Shannon, while I'm trying to get this worked out. There you go. Can you see them now?
Okay. Let me get back there. Yeah. There we go. Right. The next slide, please. Yeah, perfect. So we found a few additional resources this week that we didn't present a couple weeks ago when we met. That might be of assistance to you. I think all of these have been on our the CT Boss website, but in case you haven't had a chance to look at that, the National Low Income Housing Coalition has a good practical guide on how to assist people who don't have email addresses to get that economic impact payment. And then there were some considerations, some ideas about how to get the payment for people who don't have a current mailing address either. There's a resource right here on people with DSS Husky benefits. So if you want to know how this is impacting people on Medicaid, that's a resource for that. Homebase had a decent, a kind of full spectrum policies and procedures type of thing, supportive services type of thing. One thing of particular interest, they had a couple strategies to deal with people who might have some resistance, like some of our presenters were talking about, to moving indoors. So people who might feel traumatized from moving indoors, they might have a previous prison experience, or people who use substances together and don't want to move indoors. They had some special considerations and practices put in place to help work with those people in a way that keeps everybody as safe and healthy as possible. So I wanted to highlight that. There's information on cell phone carriers, policy changes, kind of people who are allowing late payments and that type of a thing. CDC fact sheet, of course. And then if you have a chance to look at what National Alliance on Ending Homelessness is providing, they have lots of good webinars and resources. Next page. And this is the same list that we had last week of resources that, again, very comprehensive, anything you might be looking for. And then I also just want to say, give a plug again for the CT Boss website. The outreach specific things can be found on the CT Boss resource page, but there are a number of different resources, national, health related, mental health related, trauma informed practices, harm reduction practices throughout the website. So please take a look. If you're looking for something specific, you could probably find it there or in one of these links. Next page. Case conferencing. So Andrea, Matt, did you want to say a couple words about how that went last week, Andrea? Can you, let me unmute you.
Hi.
There you go.
I thought it went really well. There were only 6 people on the call. But if that's something that people are interested in, people were able to share resources. We're able to talk about common challenges, what different people are trying. I thought it was pretty helpful. It was really interesting and people fully participated. If there is something that you'd like to talk about, people were able to talk about, as Lauren mentioned, both successes and challenges. And I think that they had a lot of really good ideas. So it's really a community of practice with all outreach providers, and I would encourage you to join us. It's going to be next week at the 11 a.m. time, and everybody is welcome.
Great. Thank you, Andrea. Next slide. And then we will have another one of these meetings, an outreach meeting, Thursday, June 4th from 11 to 12. Same Zoom information that we have been using and same call-in numbers. So please feel free to join us and to your staff if they might be interested in joining as well. Next slide. And that's our contact information. I want to thank you all. Thanks again. I'll add my thanks to the presenters. We really appreciate all that you're doing and your willingness to share your experience with all of us today. I want to remind everybody that the slides will be posted on the CC Box website and the recording of this whole presentation will be posted. Any additional questions?
Yeah.
We're paying attention to the chat box. Go ahead.
Also, if people have, we're only going to do these as long as people think they're useful and helpful and valuable. So, if you've got ideas, we've got 2 more scheduled, and I think we can decide together with the case conference scheduled, and then 2 weeks from today, the regular meeting scheduled, and I think we can all decide together at that point whether or not there's a value in continuing to do this, and what specifically topics, ideas that you guys have. And if you've got any ideas in the meantime, please feel free to reach out to one of us.